The Alliance does amazing work for people who are disabled or living with long-term conditions and for unpaid carers. We're joined now by Andrew Strong, Assistant Director for Policy and Communication. Andrew, thanks for joining us. So can you talk about the value of human rights-based approaches to health and social care? And what do you mean by transformational change?
Well, human rights are quite often associated with the courts in this country. We often talk about human rights when we talk about the rights of prisoners, for example, and things like that. But actually, human rights provide us with the really basic ingredients to design and deliver services. For example, in health and social care, we really need to look at the principles of human rights and how they can actually improve what we already deliver. From our perspective, there are a number of ways that we can do that. We espouse a model called the panel principles, which is about participation of people who use support and services, the accountability of the delivery agent of those support and services, non-discrimination and equality underpinning the role of those services, empowerment of the people who are using those services to complain and give feedback and make sure that their views are properly heard and that they can co-design what happens next. But also the legality element of that. So that doesn't go missing, but actually we can use these principles to design and deliver better services in the future. In terms of transformational change, what we see in the health service just now is a continuation of where we've come from since the health service was set up. But actually there are opportunities to do things slightly differently now. We have a new delivery plan for health and social care in Scotland. What we would like to see is things pushed a bit further for more involvement of people who use support and services in the design and delivery of their care. Things like self-management really coming through a lot more strongly in what's happening. Co-production being an opportunity for people to give their views on what their services should look like, to design those services and make sure that their views are adequately heard and acted upon. And that's quite a challenging thing for the health service to do, but actually one which will really give us a lot of value in the future, I believe.
So with the upcoming council elections, what impact do things like social care have on people with long-term conditions?
I think it goes back to the human rights issue. Social care is a massively important, has a massively important role in supporting people to achieve their human rights. Social care can mean anything. It can mean supporting people to get out and about and enjoy friendships, right to supporting people to get up in the morning and things like that. But the thing to remember about social care is that we're not doing people a favour when we deliver those types of services. They're actually about supporting people to achieve their human rights. And the council elections offer us an opportunity to look again at social care. A lot of people talk about a crisis in social care, and the integration of health and social care is supposed to really think about how we can deliver support and services in the community. And the councils and the health and social care partnerships have a massive role to play in delivering that. We've just done some research into self-directed support, which is an element of the social care landscape. It's there to help people to direct their own support, to put in place the types of support that they need, and to use budgets from the council to make sure that happens. What we're finding though is that our members tell us of a different experience, and that experience being of long waits to achieve a self-directed support budget, that actually the choices that they can make are limited, and that actually the social work departments don't necessarily understand all of the options and all of the choices they can make. And some things need to be done about that. Some things can be done at a national level, and some things can be done at a local level, and we'll be expecting the new set of councillors to really be on top of that and making sure that self-directed support happens in the way that it was previously espoused.
So what sort of changes are we seeing in the models of primary care?
I think we're seeing quite an interesting time in terms of primary care. We're on the verge of a new GP contract, but actually we're looking at really innovative ways of thinking about the future. The Alliance's work has encompassed a number of different new models of primary care being developed. For example, we have the National Links Worker Programme, which is running through the Alliance, and that's 7 community links practitioners in 7 GP practices in some of the most deprived areas of Scotland. And they're there predominantly to support people to access community assets in their local community, which they might not know about. So going along to your GP has traditionally been, I've got this problem, how do I solve it? Now, the Community Links practitioner can speak to people about things which are not necessarily considered traditionally medical issues, but they can talk to them about things like money issues or friendships and loneliness and things like that. And they can say, here's things in your local community that you might want to access. So there might be a local community group that you'd be able to access. There might be a support and service that you might be able to access. There might be friendship groups. So that person can be there as the link into that. Now that's an innovative model. It's been taken forward and in a number of different ways in a number of different parts of the country. And the Scottish Government has given a commitment that in the next 5 years, 250 Links practitioners will be available across the country. We have a particular model that we think works and one which we'll be saying actually that has a role to play, and it'll be interesting times to see how that innovative role is taken forward. At the Alliance we also have a programme called the House of Care, which is working in a number of areas of Scotland to co-design services with health professionals, including GPs, and that's really looking at all of the elements that are needed to help support people to co-design the type of support and services that they need from the health service. That's a really innovative project. It's one that's in development and one which will, over the next few years, be rolled out, I'm sure, and real opportunities through that to improve the experiences of people who use support and services.
And what would you say is the role of digital in supporting transformational change?
Yes, again, this is something which we have a couple of projects working on. I think digital has a massive opportunity for us. It presents opportunities for people who use support and services to really, again, co-design and co-produce the types of services that we want to see in the future. Some examples of that, the Alliance has the ALICE programme, which is an online index, open source for anyone to use, which is a collection of community assets, of things which are in the local community or at a national level that people can access that maybe are less findable. But actually, if you put them on an online resource, people can put their postcode in, they can say something like mental health, and they'll know exactly the type of resources that are available to support them. And that, as an open source index, is also available for people to put up their own examples of community assets. Now that's a really innovative tool. It's available, as I say, for anyone to use it, not just for people who are trying to access it, but for people who are in the position, say, of a GP or a health professional, where they're looking at what actually can help this person to live better, what can help this person to stay well. One other example that we're looking at just now is through the RGP project, which over the last few months has been out and about across Scotland asking people what digital technology can do to improve their experience of going to the GP. Now, they've recently come up with 3 different new innovative ideas which they're asking people for their views on. One of those is a personal profile where people will be able to share non-medical information about their life with their GP, so that can inform their future consultations with the GP. Secondly, there's an app which is looking at images of skin conditions, so minor skin conditions which you can send to a clinician and they can tell you what steps you need to take next. And finally, we're also looking at consultations and how people can maybe replay a consultation that they get with a GP. They can have digital access to keep on repeating it so that they can remember what they've been told, how they can self-manage, etc. So those are the sort of opportunities that we're looking at around digital, and there are many, many other opportunities. But I think in terms of where we are with digital technology and the future, there are many opportunities where we could really be capitalising on and making people's lives better as a result.
And finally, Andrew, can you talk about self-management and supporting people with long-term conditions?
Yeah, self-management has been a long-running concern that the Alliance has had. We've, from our early days, and we were formed in 2006, and one of the original messages that we had was about self-management really being able to support people to live better. In 2009, we worked with the Scottish Government on a self-management strategy for Scotland, which said that self-management wasn't about going alone. It was about being informed by professionals and being able to make judgments and decisions in conjunction with professionals about the type of support and services that you might need in order to live well. Subsequently, we've managed the Self-Management Fund for Scotland, and that over the last 8 or 9 years has supported 244 innovative ideas coming from largely the third sector to take forward self-management programmes in Scotland, and that supported a whole range of people living with long-term conditions. It's really looked at what does self-management mean in people's lives, how can people go about supporting themselves, how can health professionals support that, what's that mean for the future. We've also set up a network in Scotland of people who are interested in self-management, and that's involved health professionals, it's involved people with long-term conditions and others, and trying to come together to talk about how do we make sure that self-management is on the agenda of all health professionals, that it's a massive part of the future. I think one thing that we're quite pleased about is that actually some of the strategies coming from Scottish Government really mention self-management and really see it as an integral part of how we achieve the shift in the balance of care. But what we need to see more of is this put into a practical setting of health professionals talking about self-management and using self-management and supporting people to self-manage their long-term conditions. So I think it offers us opportunities again, and we're really looking to the future and how that can support the change.
Andrew Strong, thank you very much.